Thank you, Ramaiah. It's a great honor to be here. I think I'm the only one, the international speaker from the. I just crossed the Pacific Ocean, like 6,700 miles, apart from here. So, okay, today's my topic is SMA arteritis causing aneurysm following COVID-19 infection. Okay. 66 years of female patients complaining of abdominal pain. So she came to our emergency office, and then her past history was about 2 weeks ago, like a COVID infection she had. But except this COVID infection, she doesn't have any kind of comorbidity, like except hypertension. So initial vital sign was stable, no fever, and just on the physical examination shows epigastric pain, tenderness. So I just checked the initial lab. So CRP and ESR was increased, but otherwise, other labs are normal. So I just checked the initial CT scan, shows just the proximal SMA was arteritis, So inflammation is surrounding SMA. So it's pretty much, the location is, the arteritis is pretty much challenging. So I just start with broad antibiotics like vancomycin and ceftriaxone. So and then blood culture was negative. So I just put the antibiotics for about 10 days, but still CRP is increasing, until 16. So after 10 days, I check the CT again. So CT shows little bit dissection of SMA, and the inflammation is increasing. So I just realized, she was a COVID-19 patient about 2 weeks ago. So I just find out the steroid should be start earlier. So I just start the steroid after 10 days of broad antibiotics. So, and then CRP was decreasing, and then after 1 month, the CT scan shows SMA was like aneurysm, like a 5.7 cm. So it's it seems like a true aneurysm, but I'm pretty much sure it's like a pseudo aneurysm, right? Yeah. So in that moment is, I think, first my oh shit moment. It's been 5.7 SMA, but the location is pretty much challenging. It's just proximal to the 1.5 or 2 cm apart from the aorta. So I think this is my second shit moment for the this presentation, because I think TED is endovascular treatment decision, but I brought open case. So this is my second shit. So okay, so I just opened the whole abdomen, and as you can see, the SM bridge is crossing the low part of aneurysm, and aneurysm is not just a regular aneurysm, it's like an inflammatory aneurysm. It's all the tissues are inflammatory changing, and so that's why I decided to open, because endovascular treatment is much easier for her, but her age was at 66 years, a healthy woman, and I'm not sure the proximal, the SMA is very fragile, so I want to check out the whole part of the SMA branches, and so I want to save the middle cardiac arteries for the first branch. So I just dissected all the aneurysm, and then I put the PTFE grafts for the interposition bypass.
So Dr. Jung, can I just, before you go further, can I ask a question? We don't see Behçet's that often here. Is this anything look anything or concern you at all for Behçet's?
You mean the chest?
This aneurysm. Behçet's.
You would know.
Oh.
It's autoimmune.
Behçet's syndrome.
Syndrome? Oh.
No.
Did you have
Okay.
any other manifestations like cutaneous or,
I didn't do it. So,
Okay.
Yeah. So, okay, but post, OPLF finding shows that there's no any growth. So I mean, it means like it could be viral origin.
Is PTFE the ideal conduit for this kind? Imagine. Yeah, no abscess ulcers or anything like that.
Okay,
So I don't think she has any evidence of BHS. So post-obesity finding was okay. Yeah, everything is okay. But until about 1 year follow, she's okay. So I think, okay. So the consideration is arteritis is like, as you know, all the inflammation of arterial wall. So mostly infectious arteritis, the blood culture are positive about around 50 to 85%, but little is known about the arteritis in COVID-19 patients. So most of them are improved with the steroid and conservative treatment. I think the mechanism of arteritis in COVID-19 can be directly infected endothelial cell, or cytokine storm cause endothelial cell dysfunction, or immune response. So according to previous reports, the high-dose steroid in the management of arteritis in COVID-19 is very important. So I think it's very important to differentiate the viral infection if a patient with a history of COVID-19. So in this COVID-19 pandemic period, so that's why I brought this case. Thank you for listening.
Nice case.
Yeah.